And your kids are?
Yeah, she goes to iPrep.
Oh.
And on Biscayne, the Carvalho school.
Yeah, yeah, yeah.
And the little boy is in he's like daycare preschool kind of thing. Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Our blood vessels work to carry blood to and from our heart. And however, damages from venous disease can disrupt this flow and can cause symptoms that worsen over time. Here to talk about this, and most importantly, to talk about treatments, is Dr. Edgar Galinanes, a vascular surgeon at Miami Cardiac and Vascular Institute. Thank you for joining us, doctor.
Good morning, Kathy. How are you doing?
Good, thank you. Now, talk to us about what it is that you do as a vascular surgeon.
So as a vascular surgeon, I'm really responsible for treating the whole part of the cardiovascular system, anything from arteries to veins, pretty much outside of the heart or outside of the brain.
Now, as we get into the venous diseases, what is important to know about the heart and our blood vessels? So give us like a 101.
So, you know, whenever I discuss cardiovascular disease with my patients, I start from the beginning and I let them know that the circulatory system is divided into two. You have your arteries and you have your veins. Your arteries have the job of bringing blood from your heart essentially down to your feet or your organs. And your veins have the hard job of returning the blood. Now, the veins have a kind of a harder job that they have to go against gravity.
Okay. Now, how does something like this become a disease, though?
Exactly. So after time, after standing for long periods of time or sitting for long periods of time, patients can have a significant amount of discomfort or troubles returning that blood. Right. It was actually one of the oldest health concerns dealing with human species. It dates back to the time of the Greeks. It was actually first described in ancient Greece, where the soldiers would stand all day, and these, unfortunately at that time they were adolescents, these adolescent males would have horrible venous disease, and Hippocrates actually described treating them back in then.
So what happens to the veins exactly? I mean, you mentioned standing obviously for a long period of time, but over time, obviously, this gets worse. So what are we seeing happen to the veins?
Correct. So what eventually happens with these patients is they develop what's called venous hypertension. So whenever we think about hypertension, we think about the arteries. Same blood pressure you take when you visit your primary care doctor or you go to your local pharmacy. But we're talking about a different type of blood pressure. Remember, your arteries have a high pressure system. All right, and they take blood away from the heart. In order to do that, the veins require for them to be a low pressure system. And unfortunately, whenever these the veins start developing dysfunction, they
become high.
Correct. They start accumulating blood. That increase in blood in the legs causes increase in hydrostatic pressure or increase.
So now it's happening way too fast for it to keep up.
Exactly. It's actually creating a decrease in the gradient between the arteries and the veins, causing decreased blood flow. Okay,
so now if your blood flow is affected, that means it probably affects other parts of the body as well, other health issues?
It can if you let it progress. And obviously you can have several several ranges of complications. Obviously, the gamut can run from just cosmetic veins, such as varicose veins or
Right.
reticular veins, to actually getting swelling in your legs, or even developing an ulcer. And
Okay.
even the worst can even be a blood clot.
Wow. But this happens over time. So how long
Correct.
does it take for a venous disease to form? You mentioned maybe someone can begin even as early as adolescence?
Correct. There's risk factors.
Okay.
Obviously, one of the most important risk factors, genetics. All right. A secondary risk factor is standing long periods of time or sitting long periods of time, not being
Okay.
mobile. All right. So obviously, I gave the first example of the soldier standing for long periods of
Right.
time, but it's often seen in people
That
who
sits.
sit or stand.
Okay.
Very common in professional health professions. Is very common. Retail. You see a lot of retail workers. Airlines, people who work in the airport are usually standing for long periods of time. We see that. In addition, very common in women, very much
Okay.
after pregnancy.
Why is that?
Well, during pregnancy, the blood volume in a woman increases by 25%.
Okay.
So that blood has to go someplace. The veins have a job of capacitance. Essentially, it's a reservoir. So they dilate, okay, to basically contain that blood. That causes the valves in the blood, in the veins, to form a little bit of dysfunction. The good news is, majority of the times, this will resolve within 6 to 9 months after pregnancy. However, if it doesn't, it can lead to some serious vein dysfunction and discomfort.
And we mentioned the lack of exercise as well if you're not mobile, long periods of standing, but obesity is also one of those factors.
Correct. Remember, when we talk about obesity, there's different types of obesity and where people particularly retain their fat. Lots of patients retain fat in the abdominal area, and that can cause increased pressure onto the veins as the blood is trying to come up from the feet back to
Right.
the heart. That increased pressure, again, can contribute to the phenomenon of what we call venous hypertension.
Now, I do want to take a moment to let our viewers know you can call in if you have a question. The toll-free number is 855-796-4475. We'd love to hear from you. Now, let's go through some examples, doctor. And I want to start off talking about the varicose veins because they're the most common, the ones that you hear about. So what's the general risk for a varicose vein?
So a varicose vein can run the gamut from just being a very aesthetic, non-appealing a feature of venous disease to actually being very troublesome. You can actually get something called what's a superficial vein thrombosis. That's where a blood clot in one of these varicose veins, and that can be quite painful.
Now, I think varicose veins, and I automatically just think cosmetic. You think, oh, I can see it, I'll go take care of it. But if I see it, does that mean that there's something underlying?
Exactly. So it's almost like an iceberg. The varicose vein might actually represent just the tip. There may be something further underneath that needs to be evaluated. So if you do have a varicose vein, I would implore you to go see your physician and ask them, should I be evaluated?
Right. Now, there are different stages of venous diseases, correct? So what are the stages, and at what point are you going to go see your doctor because this is worrisome?
Correct. So the ranges that we have classified them, 1 to 6.
1 to 6.
1 being the reticular veins, spider veins, the ones that are unsightly. 2, varicose veins, defined by greater than 3 millimeters.
Okay.
3 is when you start actually getting swelling. So this is often noticeable in the patients that travel. Once they get off the plane, they notice that, oh, I have some ankle swelling. I typically don't have this.
Okay.
4 is when you actually start seeing some chronic venous stasis or skin changes. That's when you can actually see the darkening of the legs, or you can actually see what we call pitting edema, or the skin actually. The word we use is lipodermatosclerosis. It's actually a change in the texture of the skin itself.
Okay.
So it doesn't feel as smooth as
affected by the
would.
veins.
Exactly, from that increase in pressure. Your body is actually adapting to that increase in pressure. Because if you think about it, it's basic physics. You have a cylinder full of fluid. And if that fluid, from basic physics, the greatest pressure is going to be at the base. essentially our ankles.
Right.
So our body will adapt into that change.
So the swollen
pressure.
ankles,
Exactly.
that's a very big indicator.
Exactly. And then 5 would be a healed ulcer, somebody who had an ulcer, and 6 would be an active ulcer. That would be the worst.
Okay. We have a caller. We have Maximo from Davie. Maximo, are you on the line?
Yes, ma'am.
Hi, Maximo. Thank you so much for calling in.
Yes, ma'am. Thank you.
Go ahead.
Doctor, I have a quick question. I've been living in North Dakota, and with the drastic weather change, I came down on vacation 2 weeks ago, and I do have had varicose veins around my thigh, my inner thigh and ankle area. And that being said, 2 weeks ago, I just noticed that my legs do begin getting like, heated, very warm. Is that due to the weather change or varicose veins?
You know, typically what we see with patients who have varicose veins is that they can complain of coldness in their feet. The heatedness is probably maybe a change in the temperature and the ambient climate. But the varicose veins can definitely be affected as you travel. Remember what I said, standing for long periods of time, and I believe you said you traveled from up north down here recently. So they may just be requiring a little bit of time till they get set back to their normal function.
Okay. And what would you recommend to begin so that I can get rid of the eyesore, or, because it looks like a puzzle, like a maze of.
Yes. So I'll ask you, have you used stockings before?
No.
Okay,
No,
first
not at
and
all.
foremost,
When I
I
was
would
younger-
recommend just implementing some lifestyle changes. The first thing would be obviously obtaining a pair of stockings, compression stockings. That will definitely help and reduce how pronounced they are. Second thing, especially after traveling, regular exercise. I think getting out, walking 30 minutes consistently will really help circulate that blood. Also, adequate hydration. Remember, when you fly in that cold temperature, it makes you really dehydrated. So you have to maintain your water intake during this time. And then, obviously, if they are bothering you or if they're painful, things that you can try that are over the counter, arnica cream is an old remedy that I find that is great for vein pain. In addition, you can try some of the over-counter, such as horse chestnut extract, which is an actual herbal remedy you can get at any local pharmacy or food store. And then you can always come see a physician to get those evaluated.
Arnica cream?
Arnica, you said?
Arnica cream. It's a plant-derived cream. The plant is actually a relative of the bonsai.
Okay.
And then the other medication is horse chestnut extract. This is a natural remedy, and you just buy it over the counter.
Okay.
Thank you, Maximo.
Okay.
Actually, you should stay tuned and keep watching, because a doctor's going to go through some of these compression socks now that he had suggested, and I'm going to jump right into it because you did bring the compression socks, and it's something that you told our caller that might be helpful for him. So what are compression socks?
All right, so to discuss the compression stocks and really explain to the viewers exactly how they function, let me go back a little bit and explain how the blood in the veins make it back to the heart. The way they make it up is through some valves that open and close. Every time you take a step, the muscles contract. That pushes the blood up the veins, past these valves, and the valves close on themselves, preventing the blood from pooling back down to the feet. It stays there at that level, at that valve, until you take another step. When you take another step, it goes to the next set of valves and next set of valves. Anywhere from your ankle to your hip. Each vein can have anywhere from 8 to 10 set of valves. So think about it almost like an elevator or a ladder.
Right.
All right. And whenever you have this venous dysfunction, the valves break and that accumulates the blood. Now, you have more than one vein in your leg. You have multiple veins. Us doctors, we get tired of naming all of them, so we divide them into 2 categories. The first category is what we call deep veins. These are the veins that run through the muscles. Now, these veins are naturally supported by the musculature, so they rarely fail. Now, then you have superficial veins. These are the veins that run through the fat. Unfortunately, the fat doesn't supply much support.
Right. So it's the
these veins.
superficial veins mostly that we're seeing with the venous
Correct.
disease.
So the stockings actually mimic the support that the muscles give the deep veins, but to the superficial veins.
Okay.
And remember, these compression stockings are special. They're graduated compression. So they're tighter down in the ankle and less tight up.
Okay.
Essentially moving the blood from the ankle up.
And both for men and women.
Correct.
Okay. So can you show us some of these and how they work?
Yes. To my left, I have several samples. We have a knee-high compression stocking, and then we have some more stockings and different styles, and they come in all different styles. I remember when my grandfather used to wear his stockings, he used to just go to the local pharmacy and buy the black stockings.
Basic.
Yeah. Nowadays, they come in all different styles. They come from
I love that they're making them very fashion forward for us ladies.
They are very
well.
fashion forward. They even make them a little bit more fashion for the men too. There are some Argyle ones with different colors, and there's also different material.
Do you recommend that they have to be like knee high, or they have to be by your what's the size?
So that all depends on the evaluation by your physician. Your physician will typically evaluate you using a sonographic exam, so a duplex.
Okay.
This ultrasound essentially measures the velocity with which the blood goes up and down, and that will let me know by that information the strength of the stocking and what height do you need the stocking.
Okay.
To what level, essentially? Do you need them knee high? Do you need them thigh high? Do you need them up to the waist? They do make them up to the waist. I typically don't like to recommend those because those are harder to put on. It can tear.
Right.
But they make a whole variety. Another thing I see is lots of patients coming to me with the zipper ones. There's ones that make them with zippers on the sides. I typically don't like to recommend those as well because what patients don't like is that they are tough to put on, typically around the ankle. But the zippers actually start above the ankle, so you still have to put the stocking on.
Might be a little difficult.
Exactly.
Now up next, we will be getting into other types of venous disease that can pose a greater risk for our health. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question, please call in. The number is 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. We'll be right back.
Us. It's what this country is made of. But right now, our bond is framed. How do we get back to us? The why fills the gaps and bridges our divides. Support your local why today. Because where there's a why, there's an us.
Addiction is a dark place, but just as each new day breaks, there's light. A light that illuminates the people by your side. Out of the darkness, you are walking with 22 million others struggling with addiction. The cure to darkness is light. The cure to stigma is love. And the cure to disease is treatment. Join us as we walk into the dawn of the new day. Together, we are stronger than addiction. Learn more at chatterproof.org.
Families come in all sizes and shapes. Sometimes your friends are your family by choice, or sometimes you're just stuck with Uncle Charles. But what we know is that you want to protect the people that are close to you. But the flu can unravel everything. Your flu vaccine protects you and your family. No matter what draws your family together, protect yourself, protect your family. Everyone needs a flu vaccine.
I may look like all the other dogs, but I was born for a purpose. To one day be your companion, your eyes to see the world. I'll be your courage, your friend. With me, you'll find new freedom and hope for a better future. A dog I'm not. I'm a Southeastern guide dog.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. With me is Dr. Edgar Galinanes, a vascular surgeon at Miami Cardiac and Vascular Institute. If you have a health question for the expert, give us a call. The toll-free number is 855-796-4475. Now, we're just getting into different types of venous diseases, and there is quite a range. So, doctor, how serious are venous diseases?
It's very serious. They can range from just being a nuisance, such as a varicose vein, to actually acquiring what the most lethal would be a DVT, or a deep venous thrombosis. And the risk of that is eventually it can transition to a pulmonary embolism. Right here to my left, you can see a vein right here, and right here you can see the accumulation of a blood clot.
Okay.
And as the blood clot accumulates, it actually can travel upward towards your lungs, and that can cause a pulmonary embolism. And if that gets lodged in your lungs, that can be fatal and very serious.
Now, what are the risk factors for blood clots?
Now, for blood clots, there's three main risk factors. Obviously, injury would be one. Second would be having some underlying coagulability disease, some genetic predisposition. And the last being stasis, being immobile, not being able to move. Often we see this in patients who take recent travel, and also in hospitals patients who can't move because they're bedridden during their care.
Now, where do they normally occur?
Typically, a blood clot will often start in your legs. And the worst is they will travel up to your lungs.
Wow. Now, how does it affect the rest of the body? If they're forming in the legs, may possibly go up into the lungs. Does it affect other areas of your body?
Well, obviously, yes. As they start forming in your legs, your leg can be quite painful. So it can swell, you can have some redness, some erythema, as we say it, and pain. And then the worst is if they go up to the lungs and they get dislodged in the lungs, and that's when you can get some shortness of breath or even have a cardiac arrest.
Now, we also hear DVT and PE together used a lot. So what does PE stand for, and how is it related?
Pulmonary embolism, PE essentially stands for pulmonary embolism. Essentially, it means a blood clot that has traveled from your legs up to your lungs and gotten dislodged in the vasculature of your lungs.
So what are the complications then if you have a patient with DVT and a patient that has PE as well?
The complications, as what I always tell my patients is, as long as that blood clot stays in the leg, I think that's the best case scenario. The worst case scenario is a pulmonary embolism. If that blood clot travels and gets dislodged in the lungs, if that happens, then again, that can be fatal. It can lead to a cardiac arrest. Now, as long as that blood clot stays in the legs, then we can, if we can treat it early, we can treat it with some blood thinners, all right? And then the worst consequence of this can be what's called post-thrombotic syndrome.
And what is
Remember
that?
Earlier in the show, I had been discussing about how the veins bring blood from the feet back to the heart using these valves. If the clot gets dislodged on one of these valves, it can break these valves and essentially cause venous insufficiency. Now, this is one of the prime reasons we see venous insufficiency in the deep system. Remember earlier in the broadcast, I had discussed the differences in the veins, that they're superficial veins that run in the fat and they're deep veins that run in the muscle. And remember, I had alluded that the deep veins rarely fail. This would be one such scenario where you see failure of the deep system attributed with a blood clot.
Here's my question though, then how do you know if you're a patient that you have DVT? Would you find that at like at stage 3, or does that start? I mean, what gets a patient to that point?
So earlier when we had talked about the different stages 1 through 6, those typically are the symptoms of venous insufficiency or chronic venous hypertension. When we're talking about a blood clot, they present with different symptoms.
Okay.
Their symptoms would be acute onset pain, essentially fast onset of pain that you hadn't had before. In addition, you can get leg swelling, immense leg swelling, and that can not just accompany.
And that's very different swelling from a venous disease.
Venous disease swelling usually is just the ankle. With a blood clot, you can see the whole leg swollen up to the level of where the blood clot is.
Thank you for clarifying that. Now, there are a number of factors that can increase your risk for deep vein thrombosis or DVT, but that shouldn't prevent you from knowing your risk. So let's take a look at this video.
Surgeon General in 2008 issued a call to action to prevent deep vein thrombosis and pulmonary embolism in patients, particularly hospitalized patients, to use the appropriate measures to try to do that. And the role of the CDC is to help make people aware of this as a public health issue, and also to have a better understanding of how common it is in our society.
People at risk for DVT or PE include absolutely everyone. It's hard to say that anything or one factor causes deep vein thrombosis and pulmonary embolism, but there are many things that increase the risk, and a number of things can work together to greatly increase the risk.
There are 3 things that are really important for patients to know to prevent DVT. Number 1 is to know the risk factors of DVT-PE, to know that recent hospital stay, immobility, surgery, birth control pills are risk factors. Knowing, do I have a family history of blood clots? Number 2 is to know the symptoms of DVT-PE. So if they do occur, the person is aware this could be a DVT and PE and be checked out for it. And then thirdly, since the majority of DVT-PEs happen in the hospital, I think it's important that patients be proactive and ask their physician, should I get DVT prophylaxis? Am I at risk for DVT or PE?
So some patients might not even know they're at risk for DVT. So what is the most important thing to know or to follow up with patients about their risks?
Well, as you had seen from the video before, genetics is a very strong predisposition. So if you have a family member, a mother or father who has had a blood clot, you yourself should see your physician and discuss with your physician your risks. Another risk, obviously, are patients who are on certain type of medications, such as oral contraceptives.
They're at a higher risk for blood clots.
Correct. Second, obviously, if you've been traveling recently, or as you've just heard from the videos, recent hospital stay or recent surgery, these obviously are risk factors for blood clots, and you yourself should be more adamant at looking at the symptoms of a blood clot.
Now, doctor, if you've had blood clots in the past, are you more likely to get them again? Are you at a higher risk for DVT?
Yes, you are at a higher risk compared to the general population.
Okay. Wow. Now, coming up, we go over some before and after images you won't want to miss. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, please call in now using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com, and you can watch a Health Channel live stream or check out videos from previous episodes. Don't go anywhere.
SCAD stands for spontaneous coronary artery dissection, and it means there's a tearing in the walls of the arteries that bring blood to the heart muscle. In recent studies, it seems to affect more than 90% women compared to men. It's a disease that is not well known, but the causes can include certain types of artery problems such as fibromuscular dysplasia and other connective tissue disorders, as well as being peri or postpartum, and then other things such as emotional stress or extreme physical exertion. The main signs and symptoms are presenting with a heart attack, and those signs are chest pain, trouble breathing, any type of discomfort in the chest. People may feel lightheaded or dizzy or sweaty, and if you happen to have a predisposing disease of the blood vessels, then definitely have a low threshold to getting help.
Because of you, I feel not alone in this world. And you let me know that it only takes one person to make you feel wanted.
We all play a role in keeping our community safe.
Every day, we move in and out of each other's busy lives.
It's easy to take for granted all the little moments that make up our everyday.
Some are good, others not so much.
But that's life.
It's when something doesn't seem quite right that it's time to pay attention.
Because only you know what's not supposed to be in your everyday.
So protect your everyday.
If you see something suspicious, say something to local authorities.
In the past 50 years, we've made a lot of progress in smoking prevention. But if we don't do more, 1 out of every 13 children alive today will die early from smoking. That's 5.6 million precious lives we can save. Together, we can make the next generation tobacco-free.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. With me is Dr. Edgar Galinanes, a vascular surgeon at Miami Cardiac and Vascular Institute. If you have a health question, give us a call. The toll-free number is 855-796-4475. Now, venous diseases range from varicose veins to serious blood clots. So, doctor, what types of providers help patients diagnose and manage these diseases?
So I would advocate a vascular surgeon would be the best provider to really evaluate and assess your risks and whether or not you do have a blood clot. Typically, the first stage in diagnosing a blood clot or venous disease is a good physical exam.
Right.
And somebody who's had adequate amount of experience looking at this is the best route to go. The next test would be sonography, an ultrasound, duplex ultrasound, where we actually measure with which the velocity of the blood goes up and down in your veins.
Okay.
Depending on those results, then the doctor can obviously categorize the level of disease you have and what risk are you, and best tailor what may be your treatment options.
Okay, now at what point though, I mean, if you're lucky enough to go straight to your surgeon, but at what point does a specialist come in?
The vascular surgeon is your specialist. Typically, you should go see your primary care doctor.
Right.
And with your primary care doctor, you bring up your concerns and ask them, should you be evaluated by a specialist? And that's when they'll send you to a vascular surgeon who is a very specialized surgeon.
Absolutely. Now, as we get into treatments, we have a few examples that help determine the best treatment. So tell us about how you work with a patient to determine the best type of treatment, doctor.
So first and foremost, I look at the level of disease. And I also look at the patient in a clinical perspective. I find that venous disease is very patient-tailored, very personalized. It's not kind of like cardiac disease where if I find a blockage, I need to open it.
Right.
A lot of this depends on the patient. So I look at the clinical disease and see the spectrum. Does the patient have troublesome varicose veins? Does the patient have swelling? Does the patient have an active wound or active skin changes? If they fall in the latter, with more severe symptoms, I often advocate more invasive treatment. If they fall in the former, maybe just some varicose veins or just some leg swelling, I always like to start the treatment with a conservative, maybe with just some compression garments and seeing how they respond to that.
And as we saw in the graphic, there's also, as you talk about individualized patient care, what are they able to tolerate, correct?
Exactly.
Okay.
And the stockings actually fall in a complete different range of strengths. So I always start in a medium, and I either work my way up or work my way down, depending on the patient. Often, patients can't tolerate a certain strength. For example, very common in my elderly patients, after a certain age, you have a lot of arthritis in your hands, and it's very difficult to put these stockings on. So what I often work with my patients, it's not about eliminating their symptoms entirely. It's about getting them to a point where they feel comfortable and we can control them, control their symptoms with an adequate compression. So they may need something less.
Now, we talk a lot about invasive and non-invasive procedures. So can you talk to us about the differences when it comes to treating venous diseases and what options are available?
Correct. And again, just like venous disease, there's a full spectrum.
Right.
When we talk about just looking at spider veins or varicose veins, treatments can consist of just sclerotherapy, which can either be done with traditional hypertonic saline or maybe even some of these newer medications. Or you can even do microstab phlebectomy. That's where we actually remove the vein. To where you have patients who have a little bit more severe disease, such as the leg swelling or skin changes, they may be better treated with more invasive procedure, which would be endovenous ablation of the vein. So back in the day, you may have heard of vein stripping. That's where they would actually remove the entire vein from your leg. Unfortunately, this was plagued with lots of complications, chronic leg pain and swelling. Remember, these veins don't travel by themselves in your legs. They travel with nerves and lymphatics. And often by removing this vein,
now you're affecting the other components.
Correct. So what we've really developed in the medical community are these newer, really minimally invasive procedures, which are actually ambulatory and don't require any general anesthesia, don't require a hospitalization. They're actually same-day procedures done in the physician's office. And these are endovenous procedures, and there's a variety of them.
I know you brought actually some examples. Yes.
I did. The first one is the newer one that I brought.
Okay.
This is called the VenaSeal. This is actually a glue.
I was going to say, it looks very much like a glue gun.
And it is a glue gun. It's essentially a glue.
Okay.
And what we would do is I would, under local anesthesia, using an ultrasound, I would get percutaneous access to the vein. I would insert a catheter, please.
Okay.
And this is the actual glue. And it actually is a derivative of glue.
Okay, and you would insert that?
I would insert that into the vein, and then I would inject the glue into the vein, and I would slowly withdraw, and I would manually compress the vein with my hand, gluing the vein together.
Gluing the vein together. Now, a patient comes in for how many of these? Just one procedure?
One per leg.
One per leg.
Correct.
And that should do the trick.
That should do the trick, pending the results of your ultrasound and the severity of your disease.
And how long does this procedure take?
This procedure can take anywhere from, let's say, 20 to 30 minutes. What I tell my patients is they can expect an hour-long visit to the hospital.
Okay.
I mean, to my office. And typically, there is no recovery time. You're out and you can drive yourself.
That's
back
incredible.
home. Yes.
Now, you feel the results instantly, though?
You do feel the results
Okay.
instantly, which is really remarkable. Majority of my patients feel instant relief from their symptoms and are very happy with the results.
Okay. Any other treatment you want to discuss or talk about?
Yeah, the more traditional one would be radiofrequency ablation. Okay. This is a RFA catheter. So this is a catheter that actually emits heat. So if you look at the tip, this tip gets really hot.
It's like a coil, yes.
Correct. It gets up to 120 degrees Celsius or 200 degrees Fahrenheit. So this actually requires more anesthesia than the VenaSeal, than the glue.
Okay.
So that is one benefit of the RFA catheter, the VenaSeal versus the RFA catheter.
How does that one work?
This one, by creating heat.
Okay.
So it gets really hot and essentially just...
In the vein.
In the vein, and essentially just closes the vein. I insert this into the leg, and as I start withdrawing, I start closing the vein segment by segment. I remove everything, nothing stays inside the patient, and the vein stays closed. And essentially, what many viewers are probably asking yourself, well, what happens to my blood? What happens with the circulation? Well, like I alluded to, there's more than one vein in your leg. There's multiple veins. Again, remember, there's superficial, ones that run through the fat, and deep veins that run through the
You just have to find a new
muscles.
route.
Exactly. We reroute the blood, much like we do traffic.
Exactly. We need a Waze system in our veins, in our body. My other question is, how do you know when to use this technique to that one, depending on the patient?
Well, I have a conversation with my patient,
Okay.
and I discussed with them the pros and cons of each procedure. The VenaSeal has a higher rate of phlebitis, so that's inflammation of the vein. It's self-limiting, but can be kind of nuisance.
Okay.
Also, the VenaSeal has the benefit that the patient doesn't need to use the stockings immediately after the procedure. In addition, I can close a greater length of the vein. The RFA catheter can only close the vein from below the knee up to the groin. The reason being is that below your knee, your saphenous nerve runs with your saphenous vein. And by using the RFA catheter, I can burn that nerve and cause a great deal of discomfort.
And with this, though, as you mentioned, you have to wear the compression socks afterwards.
Yes, typically the recommendation is several weeks afterwards.
Several weeks afterwards, okay. Now, I do want to take a moment to remind our viewers, you can call in if you have a question for Dr. Galinanes. The toll-free number is 855-796-4475. We'd love to hear from you. Now, in addition to these techniques that you brought with you some before and after photos as well of patients. So let's go through these and talk about what you were able to treat and accomplish and what process was used.
So remember, lots of times that these patients are a combination of treatments. So whenever I approach a patient, I always try to approach the patient from a medical perspective. And I try to treat the underlying problem first. Remember, in the beginning of the broadcast, I talked about venous hypertension. Well, often in these patients, what I do is I treat them with one of these two procedures, either the VenaSeal or the RFA catheter, and then we come back and we treat them for a more aesthetic result. In this case, you can see that varicose vein by her ankle, and you can see that has physically been removed using stab phlebectomies. So essentially, this is another very minimally invasive procedure done in the office under local anesthesia, and the patient has had quite good cosmetic results.
Now, will she have to come back?
I typically, after these procedures, I bring them back in 6 months to reevaluate the venous system and make sure that the veins are stay closed. In addition, I continue to follow them and also advocate good vein health.
Okay.
Lifestyle changes and using the stockings if need be.
All right, let's see our second example. What are we looking at here,
This is a cosmetic procedure where foam sclerotherapy has been injected into this cluster of varicose veins, and here you can see
it's lightened.
Yes, the vein is gone. And here it's actually interesting because you can actually see, if you look at the around the 5 o'clock position, you can see kind of a dark greenish vein that's actually leading. It's almost like a road leading into that cluster of veins. And remember, I told you about how there's a venous hypertension in the deeper veins, and there might be just an iceberg. This is almost on a miniature scale.
Of an iceberg, yes.
Exactly. You can see the deep vein, the little deep vein down there, feeding that superficial cluster. By closing that cluster, I'm able, that deep vein, I'm able to close that cluster.
Wow,
This is
incredible.
This is more of a cosmetic procedure where we just injected a medication, pilodocanol, into these sclerottant medication to cause essentially sclerotherapy and remove these veins for a more aesthetic appearing leg.
With the sclerotherapy, though, how many sessions did that have to achieve that?
Typically, what I quote my patients on is 2 to 3 sessions.
Okay.
I typically inject them and then bring them back in a period of 6 weeks, and we reassess. Lots of times the patient will want to proceed with the full 3 sessions, or they may feel that the results are adequate enough at that time and would prefer to come back another day.
I want to bring up that last graphic because I've noticed this sometimes too, that especially as, you know, we see our abuelas and abuelos, but as you age, there's almost that lumpiness to these clusters of veins. So can you explain that and what you did here? This is remarkable.
So this is a varicose vein, as you can quite see, and the saphenous vein actually leads into it. And this patient has had closure of her saphenous vein.
Okay.
And then in addition, I removed the varicose vein using microstab phlebectomies. And in this technique, I essentially use a needle, and I take these veins out through multiple small needle incisions.
Wow, and that's like a one-time procedure?
One-time procedure.
Okay. Now, what is that lumpiness that we see?
Those are the varicose veins as they adapt to that increased pressure. Almost like a balloon when you...
It gets bigger.
Exactly.
Interesting. Now stay with us because when we come back, we will go over the most important lifestyle modifications that help in preventing venous disease. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, please call in using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. We'll be right back.
We develop quality citizens who keep our core, our country, and our communities side by side on the winning side. Not for glory, but for honor. For a code that isn't written or spoken, but lived. It's what we do. It's who we are. It's the battle cry of our fighting spirit. Battles won. See all the battles Marines fight to win at Marines.com.
Did you know that people born from 1945 through 1965 have the highest rates of hepatitis C, but most don't know they're infected? People can live for decades without symptoms, but over time, hepatitis C can cause serious health problems. If you were born during these years, the CDC now recommends that you get a blood test for hepatitis C, so talk to your doctor and find out if you have hepatitis C. It could save your life. No more.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. With me is Dr. Edgar Galinanes, a vascular surgeon at Miami Cardiac and Vascular Institute. If you have a health question for the doctor, give us a call. The toll-free number is 855-796-4475. And we're going to go straight into our caller, Joanne from Miami. Hi, Joanne. How are you?
Oh, I'm really in a lot of pain.
Oh, I'm sorry to hear that, Joanne. Do you, maybe the doctor can help. Do you have a question?
Yes, I had a fall some months ago, and I injured my leg. And not only did my left leg get swollen, but my right leg got swollen too. And they're so big. They got so big, they're almost as big as my thigh. And bending my foot is almost incapable of happening. I've tried to move and I can't move. I've endured a lot of pain, a lot of pain.
And you want to know if maybe it's connected to some venous disease as well, Joanne?
Yes, I need to know if I'm on the same realm as EBT.
Yeah, you know, I think that's a very legitimate concern. And the first and foremost thing, you know, after falling, remember, trauma is a risk factor for DVT. You need to be very concerned. And I would have hoped that you would have got evaluated after that fall for a blood clot. Now, your risk of blood clot doesn't go away after a fall. It sounds like you've been quite immobile and unable to get up during this time. That in itself puts you at risk for a blood clot. So if your pain hasn't gotten better and has only gotten worse, you should definitely be reevaluated. In addition, immobility is a risk factor for venous dysfunction, and it sounds like just you know, leg elevation or even a pair of stockings may be too little for you. You actually may require what we call a wrap, a compression mat wrap. Actually, it's a multi-layer compression wrap because you sound like you're in a significant amount of pain. So the first and foremost thing I would tell you is to pick up that phone and call your primary care doctor and see if you can be referred to a vascular surgeon who can properly evaluate you in their office.
Well, the only reason why the Lord has blessed me to call you is because I couldn't find my remote control, and you're on TV, and I didn't stop looking at or listening to the program. And the pain has been so tremendous, it has caused me a lot of difficulty. I'm diabetic, and I don't need to have all this pain.
The diabetes is a concern as well.
Correct. The diabetes is a big concern.
I'm just changing doctors right now. So by me changing doctors right now, I don't have a doctor set in place at this moment.
Well, Joanne, as Dr. Galinanes said, you definitely need to pick up that phone and call your primary doctor so you can get referred to a specialist right away. And I'm so glad you tuned in. I'm so glad you watched this episode. So thank you so much for calling in. And that's such a huge component as well. You have another underlying issue like diabetes as well, correct?
Correct. It can be very, it can get complex very quickly.
Right.
Lots of times these patients have multiple comorbidities such as diabetes. They can even have lymphedema. They can have lots of factors that can make this a very complex disease that will definitely need you to seek out a more specialized attention than just your primary care doctor, and essentially need to see a vascular surgeon.
I hope Joanne gets the relief that she needs. Now, we have a list of some of those important lifestyle modifications that we were talking about, a few that you actually mentioned on the phone call. And the first one on that list is obviously avoid smoking.
Absolutely. Smoking, it can cause what's called hypercoagulability. It can actually cause you to have form blood clots. In addition, it can even cause some vein dysfunction. Leg elevation. This is first and foremost something that very easy to do, anybody can do and should do, throughout the day as needed. Adequate liquid hydration. Remember, this is about just making sure you keep enough water in you. Usually the recommendation is 1 ounce per kilogram body weight, okay, or at least half your weight in pounds. Now, obviously, take what you feel comfortable drinking.
Right.
Don't go out there the next day and start achieving those goals.
Right.
Go little by little. Avoiding caffeine and alcohol. Now, what I advocate is not, you don't have to avoid them completely, but obviously with moderation. And also, the goal is avoiding dehydration. If you decide to drink caffeine and you decide to drink alcohol, just remember to drink enough water to replace that volume that you will lose with those. Exercise regularly. 30 minutes consistent walking every day. This isn't about getting your heart rate up into that zone that you need to get a good endurance or cardiovascular workout. It's about just moving your legs.
Right.
Very common for patients. Maybe just a recombinant bike or pedaling. Avoid processed foods, carbonated drinks. The cream that we had talked about earlier, arnica is a very good cream for the veins.
And you also talked about that horse chestnut extract.
Horse chestnut, that increases tonicity.
Okay.
And this is FDA approved, and they can use this for the vein problems.
Now, for leg elevation, how frequently would someone need to do that?
As needed. I typically, if it's not that bad, I typically tell them when you get home, put your legs up at the end of the day for maybe like 15, 20 minutes.
So last minute feedback or advice for our viewers at home that are tuning in who are maybe experiencing, like as we had our caller call in, or maybe say, hey, I might be at risk for this. What do they do next?
Yeah, the next thing they should do is definitely contact their primary care doctor and have an honest conversation with them and let them know that this is a real concern. Vein disease often in the community, in the medical community, has always carried kind of this dogma of just wear your stockings.
Right.
But there's many more treatments that we can offer, and the goal is getting you to somebody who can provide those treatments for you.
Even you wear your stockings.
I do. I have mine on right now.
Oh, you see, even the doctors wear stockings. Okay, that does it for us this hour. Thank you so much, Dr. Galinanes. I'm so happy to have you here. Be sure to join us next time on the Health Channel. All Health All the Time on South Florida PBS. Follow us on social media at All Health TV. And please be sure to visit our website, allhealthtv.com, where you can watch a live stream of the Health Channel and watch videos from previous episodes. I'm Kathy Buccio. We'll see you next time.